We mentioned the contents of the axilla in the previous section. One of them is the axillary artery. The axillary artery is the continuation of the subclavian artery. It extends from the outer border of the first rib to the lower border of the tear's major muscle, where it continues as the brachial artery. Its direction varies with the position of the arm. Throughout its course, the artery is closely related to the cords of the brachial plexus. To separate the two structures, the branches of the artery are enclosed in a connective tissue sheath, also called as an axillary sheath. The pectoralis minor muscle crosses the artery and divides it into three parts. First part, superior or proximal to the muscle. Second part, posterior and deep to the muscle. And third part, inferior or distal to the muscle. Since the artery is divided into parts, the relations of the artery changes as it course. By relation, we mean the other anatomical structures in the proximity of the axillary artery. It is essential to have the knowledge about gross anatomy to better understand the body structure and function. Since the artery has numerous relationships, we will divide them into muscles, vein and brachial plexus, and go through it one by one. Let's start with the muscles that are in the proximity of the axillary artery. A little side notes for you to better memorize these relationships. We will assign colors to the structures that are related to the axillary artery. For example, the anatomical structures that are at the posterior aspect of the artery are written in yellow, and those that are anterior in pink. Lateral structures are in green, while those located medially will be written in white. Now let's start by talking about the first part of the axillary artery. It extends from the lateral border of the first rib to the upper border of the pectoralis minor muscles. The first part of the artery rests on the muscles of the first intercostal space and the upper part of the serratus anterior. These muscles are present at the posterior aspect of the first part of the axillary artery. The first part is also covered by the clavipectoral fascia, which extends from the pectoralis minor to the clavicle. The second part of the axillary artery lies behind the pectoralis minor muscles, as you can see here. The second part of the artery lies on the subscapularis muscle, meaning the muscles are present at the posterior aspect of the artery. The second part is also covered by the pectoralis minor and major anteriorly. On the lateral side, we also have the coracobrachialis muscle. Lastly, the third part of the axillary artery. It extends from the lower border of the pectoralis minor to the lower border of the teres major. The muscles surrounding this part are: the upper portion of the third part of the artery lies on the subscapularis muscles, while the lower portion lies on the teres major muscle and the tendon of the latissimus dorsi. Remember, these muscles are present at the posterior aspect of the third part of the axillary artery. Then laterally we find the coracobrachialis, and the head of the biceps is located. The entire artery, except its lowermost part, is overlapped, that is, at the anterior aspect, by the pectoralis major muscle. In addition to muscles, the artery is covered superficially by superficial and deep fascia and by the skin. Now let's look at the relationship to veins. It is not too extensive, as only the axillary vein is located near the axillary artery. The axillary vein lies anteromedial to the artery. The first part of the artery is crossed by two tributaries of the axillary vein, namely the cephalic vein and the thoracoacromial vein. We will talk about the axillary vein in detail at a later stage. As for the relations of the axillary artery with the brachial plexus, They are closely related as both these anatomical structures are important contents of the axilla. The first artery is posteriorly related to the long thoracic nerve, which is a branch of the brachial plexus. Laterally, we have the three cords of the brachial plexus. That is lateral, posterior, and medial cords. Memorizing the relations of the second part of the axillary artery is very easy, as it is related to the posterior cord of the brachial plexus posteriorly. The lateral cord of the brachial plexus laterally, and the medial cord of the brachial plexus medially. The name of the structure indicated its location of it. For example, posterior cord at the posterior aspect, and so on. The third part of the artery is posteriorly related to two branches known as the axillary and the radial nerve. Anteriorly, it is crossed by the medial root of the median nerve, as the latter passes laterally to join the lateral root. Lastly, we have the musculocutaneous, axillary, and ulnar nerves at the medial aspect of the third part of the axillary artery. That concludes the relations of the axillary artery with surrounding anatomical structures. You can review them once again with the help of this table. Now let's talk about the branches of the axillary artery. Just like how the axillary artery is a continuation of the subclavian artery, the axillary artery also gives off branches. These branches supply the thoracic wall and the shoulder region. They are named as: at the first part, we have the superior thoracic branch. The second part of the axillary artery gives two branches: thoracoacromial branch, which further divides into four branches, and lateral thoracic branch of second part. Lastly, the third part gives three branches: subscapular branch, anterior circumflex humeral branch of third part, and posterior circumflex humeral branch of third part. You can memorize the names of these branches with the help of a mnemonic and this labeled diagram. Slap the lawyer, save a patient. S is for superior thoracic artery. It is small and runs along upper border of pectoralis minor. T is for thoracoacromial artery. It divides into terminal branches immediately. L is for lateral thoracic artery. It runs along the lower border of the pectoralis minor muscles. S is for subscapular artery, which runs along the lower border of the subscapularis muscles. And P is for anterior circumflex and posterior circumflex humeral artery. They wind around the front and the back of the surgical neck of the humerus. Now, we mentioned before that the thoracoacromial artery gives off further four branches. You can easily remember them as ABCD, where A is for acromial artery, B is for breast or the pectoral artery, C is for clavicular artery, and D is for deltoid artery. That ends our discussion on the axillary artery and its branches. Now that we have talked about the axillary artery in detail, let's briefly look at the axillary vein. The axillary vein is formed at the lower border of the teres major muscles by the union of the venae comitants of the brachial artery and the basilic vein. It runs upward on the medial side of the axillary artery and ends at the lateral border of the first rib by becoming the subclavian vein. The axillary vein receives the cephalic vein and veins accompanying the branches of the axillary artery. The deoxygenated blood from the axilla, upper limb and thorax passes through this vein before it reaches the heart. The vein lies medial to the axillary artery. The following structures intervene between the artery and vein: medial cord of the brachial plexus, medial pectoral nerve, ulnar nerve, medial cutaneous nerve of the forearm. The medial cutaneous nerve of the arm is medial to the axillary vein. That ends our discussion on the axillary artery, its branches, and the axillary vein.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.